truly amazing. At Niagara Health, the key vision is by 2028, we will be a 3-site hospital. Our 3-site system will include 3 cornerstone hospitals, Niagara Falls, St. Catharines, and Welland. By the time we get to the 3-site hospital system, patients and families will have access to the highest quality clinicians for aging and wellness, stroke, cardiac, cancer, mental health, and women's and babies. And they will be treated in a very modern healthcare system where we have state-of-the-art equipment, state-of-the-art buildings, which therefore will have best outcomes and best care. Services will be much more connected than they are now because we will have up-to-date infrastructure as well as information systems so that patients and their families' information travels with them.
Culture is what Niagara Health is really made of. It's the opportunity for staff to engage with patients. It's the opportunity for them to engage with each other. Part of my job in our culture department is thinking about the wellness for our staff, the opportunities for them to feel like when they're coming into a building that they're taken care of and so that they can take care of others.
With focusing our resources at these 3 sites, we actually will enable better recruitment of staff, better retention of staff, and most importantly, best outcomes for patients.
I really wanted to become an ally on this project in order to help alleviate some of the fears in the community and start enhancing that conversation in different areas and ensuring that we are looking at the lens of not just process, not just policy, but the personal touch.
I'm glad that I became a patient partner. I'm glad that I was able to get behind the scenes and understand the decision making that Niagara Health makes. Decisions are made with a lot of thought, with a lot of engagement. As a patient partner, I was asked, I was listened to, and I was heard.
We want the region to feel and our staff to feel like we've considered how we can really support best patient care and also support staff to be able to do their best jobs every day.
Quality care is about people, not about a building. The future of healthcare requires access to family doctors and other community-based care providers. The Niagara Health System is working closely with communities affected by this change to provide new ways to access healthcare.
We are blessed to be able to have these centers of excellence coming to Niagara and ensuring that Niagara is taken care of as a whole.
We don't want to leave our communities to go get care outside of Niagara region. We want that care right in our own community. So for us to transform the way we're doing right now, we'll take those services, those specialty services, and bring them close to home.
We're going to get the best care possible. Hi everybody. Hopefully you can hear me okay. Yeah. Thank you so much for joining us tonight to have a conversation about Niagara Health's vision for what hospital services will look like in the future. My name is Lynn Guerrero. I am the President and CEO of Niagara Health. I am a proud resident of Niagara, and I have spent the last 36 years of my career, which is basically my whole career, working in the healthcare system in various parts of the sector. So welcome and thank you for coming tonight. I'd like to just take a moment to acknowledge the lands on which we gather. Niagara Health remains committed to highlighting inclusion as a key driver for providing high-quality care. We are committed to listen and learn more about the history and current experiences of Indigenous peoples, and I acknowledge my own responsibility to take meaningful action towards reconciliation in the healthcare system. One way I've continued on my own journey of learning and reconciliation is to support the development of our very first Indigenous Health and Reconciliation Strategic Plan, which was created with input from many leaders from the Indigenous community across Niagara, with their input, and was actually created by our newly formed Indigenous Health and Reconciliation team at Niagara Health. The plan will be launched in the coming weeks for you to see. So a little bit about the agenda for this evening. My hope is that we get to have a dialogue, and we look forward to hearing your ideas and concerns. I'd like to welcome, for those of you who are in the room, we also have people who join us online, so this is being broadcast live. So our plan to build a 3-site model of care here in Niagara has been 10 years in the making, so this is not a new plan. We were very lucky to maintain our momentum towards this plan during the pandemic, and we're very happy and very proud actually to break ground on the new South site this past summer. I'm joined on stage by 2 of my colleagues, Angela Zangari, who is the Executive Vice President, Finance, Redevelopment and Facilities, and the Chief Financial Officer, and Dr. Satish Chawla, who is the interim chief of staff and executive vice president of medical affairs. The remainder of the executive team is in the room with us. We have board members in the room and lots of the Niagara Health team in the room, which I'm thrilled to see. I want to thank some of our partners for being here. So we have people here from the Niagara Ontario Health team, and I believe one or more of the primary care providers here in Niagara. Unfortunately, Mayor Diodati could not be with us. We did sort of chat with him and give him the highlights of this presentation, but he was out of town tonight at an out-of-town meeting. Rest assured, we have been working very, very closely with him and his team here in Niagara Falls on the planning of the South Side. So this is one of many community engagement sessions we have planned across the region on the three-site hospital model. And we're very fortunate in Niagara to be building a pretty big, brand new hospital here in the region, a mere 10 years after completion of the St. Catharines site. So that's pretty unique in a region of Ontario. As well, we are already in discussions with the government on a substantial renovation and redevelopment of the hospital site in Welland. So redeveloping that site at the current land that we have there. And it will be a substantial redevelopment in order to fulfill the model that we have in mind for the three-site system. We are well ahead of some other communities in Ontario, given that many people fell behind in some of their capital planning during the pandemic, but we were very lucky that the South Niagara project team, we sort of kept them isolated from the pandemic work and kept them working, so we didn't lose any time on the redevelopment plan for the new South site. One of the good things about doing such a massive project as this is it really forces us to think about how we're providing care at all of our sites and how we're providing care to all of the communities in Niagara. And we really do need to make sure we're doing that planning well ahead, and that's why we're here tonight. So we're 10 years into the planning, but I want to remind everybody that we're still 5 years away from opening those doors, and therefore we still have a lot of time to plan and to get it right. We've been working really hard with the municipalities. I just mentioned Mayor Diodati, but in fact we've been working with all of the mayors across Niagara, as well as the provincial government and many of our healthcare partners, to look at how we're going to provide high quality hospital care in a system of multiple healthcare providers. So hospitals are just one part of a pretty complex system, and we'll talk about that in a moment. And we're really here to hear your thoughts and your concerns today, so hopefully we'll do so. I really hope that the conversation today is just the beginning of the conversation as well. So there's lots of other things and times where we'll, particularly for the Welland site, where we'll be continually engaging with the communities. Before we just jump in then, I just want to pass things over to Harpreet Bassi, who's going to act as our moderator this evening. Harpreet is the Executive Vice President, Strategy and Communications at Niagara Health.
Thank you, Lynn. Thank you all for attending this evening. My name is Harpreet, and I'm going to be facilitating the question and answer period following the presentation. So we're going to start with a brief presentation that's going to overview our regional hospital plan, and then we'll open it up for questions and answers. We do have some pre-submitted questions that were sent through our website specific to Niagara Falls, so we'll answer those questions as a starting point, and then we will open it up for some questions and answers. There are cue cards in the back of the rooms for those of you who don't want to ask your questions directly. We do have runners, so if you have a question, please feel free to put up your hand. Also, we have some rules of engagement, and I'm not going to go over the rules of engagement, but we're hopeful that you're just respectful of each other, respectful of the space, and respectful of the speakers. And that's essentially all that we're asking. And I'd like to welcome our friends from Fort Erie SOS who come to every session, and welcome them here again. And one more time with gumption, invite them to share their questions in writing, but also allow others in the room to ask questions. And with that, I will hand it back over to Lynn.
Thanks, Harpreet. Okay, so just start off with a little bit of an overview. We really believe that every person in our region deserves to live every day of their life in the best health possible. And as a multi-site community hospital system, our focus on teaching and learning, research, innovation, and partnerships propels us to continually improve care and make differences in people's lives. In 2023, Niagara Health launched our new strategic plan, and the root of the plan is people, which is primarily, besides our teams, are our patients in our community, so those of you in the room. Central to the plan is designing a hospital system around the needs of patients, families, and their loved ones. And our goal is to make it easier for you to access high-quality hospital services and improve your experience. So, as I mentioned earlier, it's essential to recognize that hospitals are but one piece of a really complex healthcare system, almost like a puzzle. And that's why we work very closely with our partners, other providers of healthcare within the region. And of note here, we color them differently because they're the foundation of the healthcare system, and that is primary care. And by primary care, we don't just mean family doctors, but the teams that support family doctors, home care, long-term care, emergency medical services, so our paramedic colleagues, public health and community health centers. So in order to deliver patient-centered high-quality care, all pieces of this system need to function seamlessly. And high-quality healthcare is not based on any one thing like a physical building, which one of our nurses so eloquently stated in the video. Now more than ever, you can see here that high-quality healthcare relies on partnerships. And this is particularly important as we look at, and we'll talk about them in a moment, some of the external pressures we're facing, such as a shortage of family doctors, a shortage of long-term care beds across the province that we're really feeling here in Niagara, and a shortage of healthcare workers across all sectors of healthcare. So yes, at the hospital, but a shortage of healthcare workers across the entire system. And access to hospital services is critical to one's health, but hospitals cannot do it all. And Niagara Health, as the hospital system, needs to ensure that we're focused our resources on providing hospital services while partnering with others to help them deliver on some of their accountability in the healthcare system. The research is really clear, for those of you who care to look, that access to comprehensive team-based primary care available to you when you are ill, so not a week from now, but today or tomorrow, is the foundation of a high-performing health system. And the evidence of that is very clear. Comprehensive team-based care is more than strictly seeing a doctor when you're sick. It's a team of professionals, including family doctors, professionals such as nurses, nurse practitioners, dietitians, mental health workers, and many others, who assist you in staying well and help you to proactively manage long-term illnesses or chronic conditions that you may have. They do things like cancer screenings, they manage your medications, they conduct well baby checkups, and the list goes on and on. Access to that type of team-based primary care is what Ontarians deserve because we know that that's the best care possible. We also know that Niagara region is underserviced in the area of primary care, so it's going to be a challenge. And we're working with our healthcare partners, as well as the provincial government and all of the mayors, as I've mentioned, to expand access to team-based primary care in our region. So although it's not the hospital's role, and nor do we have any mandate in primary care, we feel it's extremely important and part of our role to advocate for primary care and to partner with others to make sure that we increase the access. So let's talk a little bit about why we are evolving to the three-site model. So first of all, we do face several major challenges that really do require us to change the way we're operating. And one of the obvious reasons is our growing population, but the population, as we see an aging population, is becoming more complex in their healthcare needs. And this is creating significant pressures on the hospital system. And I'll just give you a couple of examples. As a result of these pressures, we are one of the busiest emergency departments in the region. That's our region from a healthcare perspective is Hamilton, Niagara, Haldimand, Brandon, Burlington. So it's a pretty significantly large region. We are one of the busiest emergency departments in the region, and we're also performing the highest number of day surgeries. So as a community-based hospital system, we are significantly large when you look at how many patients we treat per day. The next thing is our team shortages. So as I mentioned, like many hospitals across the province and the country, we're facing shortages of healthcare workers across all of our teams, but we're really feeling it the most in those who are trained to work in our emergency departments and in our operating rooms. We have currently over 400 staff vacancies with particular challenges in recruiting nurses, personal support workers, and medical imaging technologists. And these shortages exist across all areas of the hospital, not just with a specific team. And that number does not account for our physician shortages, so that is in addition to the 400. And that mostly includes doctors who are trained in emergency medicine, anesthesiologists, and our general internal medicine physicians. So we're doing everything we can to constantly recruit for staff and physicians. We've filled over 2,500 positions between April and December of last year. So in an 8-month period, 2,500 roles filled. So there is a constant churn in healthcare with people coming, going, moving, retiring, going from full-time to part-time. It's a very complicated puzzle of how we have to staff the hospital systems. We know, based on just demographics and the rate at which students get trained in healthcare professions, that we will be dealing with these kinds of shortages for years to come. There is no short-term fix for this issue. So the next issue is disconnected care. So we know we need to evolve to create a more connected and better organized services around patients. It might surprise you to know that Niagara Health still uses paper records and very outdated electronic systems. And this will change in the fall when we launch our new health information system at Niagara Health. In addition, some of our sites don't have certain specialties that exist at the site. And often residents are confused about where to go based on the health concern that they have at the time. And we really do want to take that confusion away. So not only are patients sort of demanding a more connected system, but our staff and our physicians are also asking for a more connected system. And so that's something that we really listen to from frontline staff. The health information system, as well as the 3-site model, will go a long way in creating a more connected teams consolidated across only 3 sites. So the next issue is outdated infrastructure. So the current sites in Port Colborne, Fort Erie, and here in Niagara Falls are quite old and are beyond the point of renovation to meet a future modern healthcare system. As well, the site in Welland requires major renovations and updates. So we really do need to bring these facilities into the 21st century, and the new South Niagara Hospital will be a massive step towards that. And finally, limited physical capacity. So if you've been to any of our sites recently, you'll probably feel that on any given day, we are operating well beyond our current physical capacity. So the occupancy rate is typically often at about 115%, and you can tell by that number that that means people are being taken care of in unconventional spaces, what you might know as hallway medicine. As well, our emergency departments are significantly overcrowded. A safe occupancy rate in hospital speak is around 80 to 90%. We never even want to be at 100, so being at 115 is a problem. In recent times, we've had up to 100 people admitted in our emergency departments waiting for a bed. So that means they're waiting in the ED because we have no beds to put them in because we're over-occupied, which means our ambulances might be backed up because they don't have any stretchers to transfer their patients to. So we really do need to evolve and build new space, expanded space, so that we can accommodate the growing and aging population. And we are so lucky that we are now at a point in our history where we can actually do this. The time to do it is now, and the plan has been more than a decade in the making. So we'll step you through a little bit more of the plan as I turn it over to Angela.
Thanks, Lynn, and welcome everyone. My name is Angela Zangari, and I'm the Executive Vice President for Finance, Redevelopment, Facilities, and the CFO here at Niagara Health. And I've had the pleasure of working at Niagara Health for almost 33 years now, and I've lived in Thorold my whole life. So just a little bit about our future vision and where we're at as far as our plan to transform our care. So we're well on our way to moving towards that model that benefits all Niagara residents, no matter where they live in the region. And in order to provide the best quality of care to our patients, we need to focus those limited resources that Lynn referenced and build the seamless hospital care across Niagara with the 3 cornerstone hospitals. So our St. Catharines Hospital, now the Marada Family Hospital, South Niagara Hospital coming, and the Welland Hospital. So these hospitals will provide patients access to the highest quality care by bringing together our staff and expertise. We're well on our way to achieving our vision to replace outdated, outgrown infrastructure with modern hospitals that will enable us to deliver truly connected care for our communities across Niagara. We anticipate that all the services will transition to this 3-site model in summer of 2028, so we still do have some time to prepare. So our future vision also includes the system that will provide access to specialized care in areas including mental health and addictions, cardiac, kidney, cancer, stroke, complex care, wellness and aging, eye care, and maternity care. And while different sites will have their own areas of expertise, all 3 hospitals will work together as part of that seamless system of care, so that as a resident of Niagara, you don't have to think about which hospital provides what service. You go to what hospital you want to go to, and you'll be, if it's not the right one that doesn't provide that service, you'll be transferred to the site that does. In essence, what it means is that there's no wrong door. So our future must also include strong primary and community care that's led by our Ontario Health team and community-based health partners. So what do these changes mean for our patients, the community, our physicians, and our staff? Patients and families will be able to access more care and services in Niagara with state-of-the-art facilities and have modern technology, private rooms, more beds, and services. By building a modern and connected hospital system, patients and their caregivers will be able to move seamlessly between services within our region, and transforming our hospitals and how we deliver care means patients will receive better access to hospital services and specialized care from the best clinical experts. Everyone in Niagara knows the Walker Family Cancer Centre is where to access the best cancer care in the region. And each of our 3 future sites will have similarly specialized programs that will offer the best of the best our local healthcare has to offer. By building a new and modern hospital system, it will allow us to recruit and retain more expert doctors, nurses, and staff right here in Niagara, and it also means more staff providing care to our patients. By bringing together our teams, it creates a collaborative and supportive environment that we have already witnessed in the Murata Family Hospital with our Women's and Babies Unit, in Welland with our eye care specialization, and in Niagara Falls with our stroke care. I really want to emphasize that quality healthcare is more than the physical buildings. It's about access to modern equipment and highly trained staff and physicians. So where are we in this process to build this seamless hospital system? We're about halfway there. So the St. Catharines Hospital opened in 2013. It was the first of our cornerstone hospitals. We just broke ground last summer on the new South Niagara Hospital, and finally we'll be modernizing and redeveloping the Welland site. The Welland Hospital will provide 24/7 emergency services, have various outpatient programs including dialysis, CAT scan, X-ray, ultrasound, have Ontario breast screening program, stress testing, ECGs, lab services, and mental health and addiction services, and also have complex care beds as well. So by the end of this process, we will have 3 modern hospitals that will be Niagara Health. So the South Niagara Hospital. So Niagara Health and our partners are creating a more modern and coordinated system of care that is centered on its patients and its caregivers. The South Niagara Hospital will have 469 single patient bedrooms, increasing the regional capacity by 156 beds. It will offer a full scope of hospital services as well as centers of excellence in complex care, wellness and aging, and stroke. It will also provide 74% more capacity for MRI tests, accommodate 7,400 more senior wellness visits, and include 12 additional hemodialysis stations. The emergency department at the new South Niagara site will be 3 times the size of the emergency department at the current Niagara Falls Hospital. The new hospital will transform the way that we deliver hospital care. There's also a number of exciting features that we have incorporated into the hospital design, making it a state-of-the-art facility that will not only improve the patient care experience, but will also benefit Niagara Health staff, physicians, and all hospital users. Patients will be cared for in private rooms where they will have access to the latest technology, improving their hospital experience. Features include smart beds, which will be capable of wirelessly sending patients bed statuses to their healthcare team. Digital wayfinding and integrated bedside terminals will act as personal electronic devices, giving patients the ability to control room elements such as lighting and temperature. The South Niagara Hospital will be a big recruiting tool to attract top talent to Niagara. We know, and we saw in at the South when the new hospital in St. Catharines opened in 2013, we had an incredible amount of interest from healthcare professionals wanting to move to Niagara and work in a new modern hospital. We anticipate the same as the South Niagara Hospital nears its completion. The South Niagara Hospital is aiming to be the first WELL-certified hospital in Canada. This certification is given to buildings that prioritize the health and well-being of users. Features such as an emphasis on natural daylight, access to gardens and outdoor spaces, and improved air quality help to make the building more enjoyable for all users, including staff. The hospital will feature an Indigenous healing space and garden, co-designed with Indigenous partners to create a safe and welcoming space for all Indigenous people. The new building is designed to meet the needs of Niagara's aging population and includes more than 160 design elements to make the building senior-friendly and accessible. So some of those features include rest stop every 30 meters, tactical walking strips, braille on signs and handrails, reduced sensory rooms and service animal relief areas. Assisted learning devices will also be available at key information desks and service areas. Niagara Health's project vision is to be environmental leaders, to minimize operational costs, and design a facility that reduces our carbon footprint, energy consumption, and waste. The building will feature green roofs on the podium and has been designed to limit greenhouse gas emissions, along with a strategic plan to move towards net zero in the future. The building will feature large, beautiful windows that give users a view of the outdoors. Approximately 50% of the property will be green space, including the northwest corner of the property, which is a designed wetland. The South Niagara Hospital is designed to be flexible and responsible with room for future expansion, both within the hospital and on the site itself. Standardized and universal spaces help improve efficiencies, reduce errors, and allows for flexibility that will make it easy to adapt for future needs. An automated transportation system will be used to move supplies and materials in an efficient and autonomous way, helping to improve workplace efficiencies. Automated guided vehicles and autonomous mobile robots will move along designated paths and elevators and will deliver materials to various locations where they will be met by staff. The Murata Family Hospital, that opened in 2013, is a great example of the success that we have when we focus our resources and bring together the most experienced experts in one building. I already mentioned the reputation of the Walker Family Cancer Center. However, we also have our Women's and Babies, Heart Investigation Unit, and Mental Health and Addictions programs, which are also examples of enhanced level of expertise that we can provide by consolidating certain services. Based on projected growth in age demographics, the South Niagara Hospital will feature centers of excellence in complex care, stroke, and wellness and aging. And based on the approved plans for the Murata family, the South Niagara Hospitals Welland will have a 24/7 emergency services with 8 to 10 beds that are observation beds, 30 complex care beds, have a long list of outpatient clinics, including dialysis, ECG, and a number of other services as well. It'll also be the administrative hub for our teams. So it's really exciting to imagine that what the Welland Hospital will become when it's redeveloped. The changes in Welland will happen in phases and will provide plenty of opportunity for Niagara Health and the community to work together as we reimagine the entire site, not just the hospital and long-term care home. Further staff and community engagement is required to submit a proposal to the Ministry of Health for the Welland Hospital site. So we're also very incredibly proud of our long-term care home in Welland. Currently our long-term care home, much like the Welland Hospital, is outdated and requires redevelopment to meet the future needs of our residents. We are working very closely with the Ministry of Long-Term Care to determine how best to rebuild the home and add much more needed long-term care beds to the region. We also want to offer other community health partners to be part of the Welland site. For example, we could have preventative care by community health partners such as nutrition classes, art classes, exercise classes, doctors' offices. We can have partnerships with Niagara College and Brock University and McMaster University and Trillium College to have academic and teaching campuses on the site. And any unused land could be developed by a community partner for senior supportive housing, an elevated transit hub, Indigenous and spiritual healing spaces, or even a community garden. It's a long list, but it's meant to show that there's a lot of opportunity and future potential for the Welland site. And with that, I'm going to turn it back to Lynn.
Thank you. So just before we get to questions, just a little bit about road ahead. So with the 3-site model, we really are committed to improving access to care, and you can hear some of the amazing things that will be happening in the new South site. Following the opening of the new South site, all hospital programs and services operated by Niagara Health will be transitioned from the older site here in Niagara Falls, the Fort Erie and the Port Colborne sites, to the South Niagara and Welland hospitals. By bringing together our limited resources, as Angela has said, the 3 hospitals will be able to offer more specialized care to more patients by the best clinical experts. The new South site, the new South hospital, will increase our emergency department capacity for the region, as you've heard. It will be triple the size, approximately, of the current Niagara Falls Emerge, and it will be able to see approximately twice as many patients per day. So it is a significant increase in Emerge capacity for the region. The programs and services at the current hospital here in Niagara Falls will be transitioned to the new South site, as I mentioned. So that site, formerly known as the Greater Niagara General, which most of the people who work there still call it that, was sold to the city of Niagara Falls in exchange for a portion of local share. So for those of you who may be up on these things, we have to raise a significant amount of money here in the community to get this hospital built. And some of the local share is contributed by the municipalities, and we did sell the site to Niagara Falls for that increase in their local share. Following the opening of the new South Hospital in 2028, the municipalities will best determine how to use the site as well at Port Colborne and Fort Erie, as well as the site here in Niagara Falls, to the benefit of those communities. So it might be different in each community. We're leaving that up to the municipalities, but suffice it to say that we're working really closely with the mayors. We would love to see those sites still have some healthcare provision there, healthcare services on the sites, but I'm sure that the municipalities will have some great ideas for how to use them. I'll leave it there, and we will go to Q&A.
Thank you for the presentation. couple of pre-submitted questions, and we'll start with those, and then I'll open it up to the floor. So the first pre-submitted question we received via our NH Engage email address was, how did Niagara Health plan to increase, how did Niagara Health plan for the increase in population growth and increase in number of seniors moving to the Niagara region?
Thank you, Harpreet, and I'll take that question. It's a great question, and I'm happy to answer that. So as we were planning for the new hospital in Niagara Falls, we looked at our Ministry of Finance and Statistics Canada population data that was, at the time it was in 2015. And as that information is continuously updated, we also updated as well. And the last time it was updated was in 2020 when we submitted our documents to the Ministry of Health. We also took other things into account. We looked at the Niagara region and their estimates for population growth and the growth into the future to 2041. So understanding that Niagara's population is growing, and actually being a resident of Niagara for my whole life, kind of feeling the difference and seeing the difference as we drive around and we see all these new developments. I'm from Thorold, so I actually didn't know that Thorold was like 8th fastest growing community in Canada. So there you go. So as we look into all of that, like, we just felt that the numbers weren't reflective of what, as a resident, we were seeing and feeling. So what we did was we went to the municipalities to pull building permits to kind of get a better estimate of the future growth. Because what we were seeing from Stats Canada wasn't necessarily jiving with what the region was showing for its population growth and what we were experiencing as residents of Niagara. So based on all of that, population growth is one thing, but also age demographics. The South Niagara Hospital was developed based on those refined statistics. So hence the reason why we're focusing on wellness and aging and having a center of excellence for that. And also include things like geriatric rapid assessment, geriatric assessment center. Unfortunately, as we're aging, and I have an aging mom who is actually benefiting from services like this, so I'm very, very appreciative of having this and these services expanded in Niagara as well. So hopefully that answers your question.
Thank you, Angela. I appreciate you also sharing your personal experience as a resident. The next question we received was, how will closing Fort Erie and Port Colborne UCCs impact ED wait times at the South Niagara Hospital?
Thanks for the question, and this is one we've had several times. It's important to note, and I think most people here will know this, that we currently have 3 emergency departments in Niagara. The Port Colborne and Fort Erie sites are urgent care centers, not emergency departments. So when you look at the 3 we have now and the 3 we will have when the new south site opens, as we've mentioned, the new south site will be significantly larger, and we will have significantly more capacity to treat patients in those areas. I think it's important to know that for most of the conditions that we see at those 2 urgent care centers are conditions that are better treated in primary care. And that's why we always emphasize that the healthcare system is complicated. The hospital mandate is to provide a certain suite of services, but our primary care partners, hopefully team-based primary care that's very accessible, that we can expand those services to make sure that people don't have to go to an emergency department for conditions that they could go to a primary care provider for. So that's why we're partnering to make sure that those communities have better access to primary care so that they're not having to go to an emerge for issues that could be dealt with in primary care. I also just want to mention that by consolidating our teams and making those teams bigger, it really does consolidate expertise. So you can imagine, us bringing in new grads into an emerge. So a new grad who wants to work emerge has a lot of additional training to get there, but a bigger consolidated team of many experts to mentor those people, coach those people, have support when things get busy and when a more recent grad is getting overwhelmed. A bigger, well-functioning team in modern space, which is what those students are used to, is going to be a better attraction for us for staff. So I think there's all kinds of reasons why we're excited about this new Emerge and how big it will be and how modern it will be in attracting people and making sure that we have excellent services and hopefully a decrease in the current overcrowding that we have in most of our emergencies.
Thank you, Lynn. I'll now open it up